So good morning students. So today our theory class will be on health system management. So for any theory class, the student must have a specific learning objectives to learn from that class. So the specific learning objectives of this session will be the defining the health management and describing the different management techniques involved in health management principles. So I will also share some of the important university questions in this chapter. So you must be able to define health management and describe the different qualitative management techniques. They can also ask the quantitative management techniques, the most important being the description of network analysis, which includes critical path method and PERT, that is program evaluation and review technique. And they can also ask about the cost benefit and cost effective analysis with examples. So moving on to the topic proper. So what do you mean by health management? So any health management is defined as a purposeful and efficient use of health system resources and to get members of the health team coordinated to work harmoniously in order to achieve the desired common goals and objectives. So what do you mean by efficient use of health system resources? So this health system resources is classified into four broad headings, that is the materials or all the inventory management and the manpower or who are all the persons who are involved in providing the health service and the minutes or time consumption and finally the money or budgeting. So these are the four broad headings by which we efficiently use the health system resources, and this has to be coordinated and to work harmoniously in order to achieve the final desired state, that is the goals and objectives. So, going on again to the definition, it is defined as a purposeful and efficient use of health system resources and to get the members of the health team coordinated to work harmoniously in order to achieve the desired common goals and objectives. So, moving on, the health system management or the health team management will have certain characteristics. So they are as follows. So the management is also always a group activity. It is not a sole individual activity. So it's always a health team approach in which the manager is being the leader or coordinator of the team. So any team will be goal oriented or people centric approach, and it is a social process by which the team socializes with the public or the health beneficiaries, and it's an art of a social science or the sociology is involved, that is the social determinants of health is involved in it, and it is needed at all levels of healthcare service delivery, that is the primary care level, secondary care level and at the tertiary care level management. And it is always a dynamic process, which means there is an iteration in which we can reframe and reorganize the program objectives in order to get the desired goal. And it has also a system of authority, that is a line of command or the line of authority in which the management technique follows, and it's universal in character, that is it is applicable to all stages or all hierarchy of that management team, and it is intangible and it cannot be measurable. So it is only a coordinated group activity which is goal oriented and people centric approach. That is the main characteristics of any management, being the team leader. Then, what are all the health systems resources that we use in order to achieve these goals and objectives? As I stated earlier, they are the manpower or the human resources and the money or the budgeting by which we organize this health team approach, and then the materials or the what are all the infrastructures, equipments, and all the materials that we use in order to deliver this health system or the health service. And finally, the minutes or the time consumption of each individual activity. And finally, all these must be equipped with the knowledge, techniques, and skills by which we deliver this management technique. Okay. So moving on, some of the important functions of the management will be the planning, organizing, directing, control, and finally the decision making. So in all these things, we have the staff being included in each levels of management. So first we have to plan a management technique and how we organize it in order to execute the plan. Finally, there is a delegation or directing of job responsibilities to each and every staff involved in that particular health process. And finally, after delivering the health service, we take a decision of how it is being delivered, whether it has achieved the programmatic objectives and goals. And this is being controlled by a manager or the team leader who forms the line of authority or the controlling authority for delivering these health services. So mainly we must be concentrating on the planning, organizing, decision making and directing or delegating the job responsibilities to each and every individual of that line of command. Moving on, as I stated earlier, what do you mean by planning? Planning is the taking the course of action of all the health activities that is involved in that particular program. And next is organizing the resources or organizational of the structure and assigning specific job responsibilities to each and every individual who are all involved in that health service. Next is staffing, or that is recruitment, training, and supervision and monitoring of all the staff who are all involved in it. And controlling the quality of activities of the members, and finally directing and decision making by issuing orders and instructions. So moving on, some more additional functions are coordinating all the activities and evaluating and monitoring at the time to time concerns in order to see whether the program is achieved its goals, and reporting it to the hierarchy or the higher levels of management, that is the top, middle and the lower level management. Next is budgeting, making an account or the account statement of all the what are all spent and all the contingencies involved in that health program. Then innovation of new work methods or new mathematical methods or management techniques in order to solve the present gap in the particular management technique. Finally, representation and delegation of all the organization at different levels. So these are the main principles or functions involved in the health system management. So what do you mean by directing and decision making? So it is mainly of the task of the group leader or the team leader who forms the health team. He must have a leadership approach, and what are all the decisions taken by him, he has to communicate it well with his colleagues or all his subordinates. Only then there will be clarity and accountability and transparency of all the decisions what he is making, and there should not be any partiality. There should be equality in providing the job responsibilities. And even if he communicates, he must motivate his subordinates and colleagues in order to perform well. This motivation can be either a verbal motivation or any materialistic involved, that is by giving some incentives or cash benefits to his subordinates, so that it will be a positive approach in order to make his subordinates to work well in that health team. Then finally, he has to supervise all the activities that is being planned in well in advance in order to identify any gap or the delay in providing that health program or the health service. So this is what you mean by directing and decision making of the team leader. So as I said, some of the important management techniques you must know. These are all divided into two broad categories. That is the qualitative aspect and the quantitative. Qualitative by means which is mainly focusing on the behavioral science or the sociology or involved in that particular health program. That is like the organizational design, what is a personal management, which means the right person to the right job, communication involved in that, and the information system, how we record all the health data. And finally, it is object oriented, objective oriented, that is management by objectives. So these are some of the important management techniques under the behavioral science. So organizational design is very important, that is a line of authority. We must know the who are all involved in the horizontal organization and vertical hierarchy in order to delegate the different job responsibilities. And the personal management, as I said earlier, there has to be motivation and communication between all the health team, that is fitting the right person to the right job. Finally, you have to communicate what are all the newer modalities that is being involved in formation of this health team and health management. Then, after management of all these problems or techniques, we have to we have to information system, that is we have to record all the data in forms of health management information system for future reference and comparison. Finally, and important is that the management by objectives, whether the health team is functioning in the objective oriented way. They are working as per the objectives which is being required in order to reach the set targets. So these are being analyzed from time to time, and if there is any gap or gap analysis, we can determine and reframe the objectives. So these are very helpful in the time to time monitoring and surveillance of the management of the health team. Then the health team manager must have an effective communication skill. That is, he must be able to listen to his subordinates and also to emphasize and sympathize with them. And he must have an effective conceptual skill. He must be able to conceptualize different organizational activities and complexities into simple procedures or simple targets and objectives. And he must have an effective human skill. As I said earlier, he must have a good communication and motivation of his subordinates. Performance appraisal should be there on. These are all some of the optimistic approach in order to derive the proper job tasks from the concerned individuals or the human resource. And developing a health team approach, he must be a good health team or a communicator. He must establish trust with his subordinates, and he must be take the responsibilities of the entire health team. So that is a good quality of a health team manager or the health leader. And he also must have an effective technical skill. So if the subordinates are unable to perform a skill, he must be able to teach them and make them efficient in it. And finally, he must be a good leader in his competency, that is competitiveness, entrepreneurship, and innovativeness, and maintaining the order and rationality, which means that there should be non-exclusion and non-discrimination and equality and accountability and transparency of all the management which is happening inside that health team. Only then the effective programmatic delivery will be there. So what are all the qualitative design so far we have discussed? One is the organizational design. Next is the personal management, that is human resources, communication, information systems. Example is a health management information system, and management by objectives. So this I have described in detail. Next is moving on to the quantitative management, that is the cost benefit analysis, cost effective analysis, cost accounting, input output analysis, and model or systems analysis. In this, the most two important thing you must know in health economics is the micro level economics, or that is the cost benefit and cost effective analysis. And some are the important other analysis is systems analysis, network analysis, which has two parts. That is the part, that is a program evaluation and review technique, and the critical path method. And also the work sampling and decision making has also some of the important management techniques you must know. So moving in detail to the cost benefit analysis. So in all the benefit or the effective analysis, the main input will be the monetary or the money which we spend for the health service. And the output differs. In cost benefit, it is expressed in the number of years gained or number of days that is prevented due to this any disability, or the number of good life of years gained due to a particular health services. That is the output of any cost benefit analysis. So as I can read, it is a factor of production and monetary valuation of an expenditure to obtain an asset or service. So this cost benefit ratio is always must be greater than 1 in order to make the health service acceptable. And the benefits are in terms of births or deaths prevented and illness avoided. That is the cost effectiveness, and it is a form of economic evaluation and value for money to the community. Next is the cost effectiveness. As I said, that is the outcome is assessed in terms of monetary fund. That is the similar but expressed in terms of results, outcomes, or improvements in health conditions. Whereas in cost benefit, the output is in the monetary gain, whereas in cost effective is the outcomes in improvements in health conditions. So this is the broad difference in between these two analyses. In both things, the input is the monetary benefit, whereas the output in cost effective is the improvement in health condition, whereas in cost benefit it is in terms of monetary gain. So it measures the effectiveness, that is improvement in health condition, reduction in incidence and prevalence of a disease, that is like example like the neonatal deaths prevented. Next is cost accounting is a set of procedure in order to determine the cost structure of various services and activities. So it is mainly to analyze the cost control operating in each activity, to detect and reduce the wasteful expenditure, and to calculate or accumulate the cost of any data, that is like hospitalization, pricing, or cost of reimbursement. And input output analysis is what are all the inputs in terms we are giving in terms of money, material, manpower, and time. And the output is number of cases treated or number of services provided. Like for example, the immunization done per week. So what is the input we are giving and output we are gaining? That is the input output analysis. Network analysis is a graphical representation and analysis of all the activities in a particular program, and this being segregated into different activities in the form of a flow diagrams or a flow chart in a logical sequence. Okay, so the PERT is a type of network analysis used for control of time and cost in complex programs. So it's, as I said earlier, it is listing of all the activities and tasks presented in the form of a sequential relationship with the time constraint in each and individual task is also noted. That is the PERT. So as I said, we have a start plan, that is a plan service. In 4 months, we recruit the staff, and in 2 months, we train them, and one more month for training, and finally the service is being provided. Whereas in order to get the equipment, it gets 2 months and 10 months for getting it installed, and the service start is 1 month. So 10 plus 2 is 12 plus 1 is 13 months we required in order to get the equipment functioning, whereas for staff recruitment and training and service providing, it is 4 plus 2 plus 1, that is only 7 months. So we can analyze the longest path in this is the equipment and installment and service providing, that is a critical path method. So in any program, we must be understanding the longest path or the greater time constraint path, and we have to analyze it in prior hand and work out different management techniques in order to reduce this longest path into the smallest one, so that the program can be efficient in functioning and providing the required health service at the required time. So that is the critical path method. So this path is the longest time duration and it determines the shortest possible time for completion of any project or program, that is analyzed by means of the gap analysis. Finally, some important things are planning, programming, and budgeting system. It helps to decision makers to prioritize the expenses and allocate the resources in prior hand, and also to plan for any group activities. Say, for example, the important thing is a work sampling. It is a systematic observation and recording of activities of each and every individual, and what are all the activities they take part in a particular given time. So, say for example, a staff is being involved in giving the OPD services, but she is unable to do staff, for example, the VH, she is unable to do the field work. So, why there is a discrepancy in her duty, job responsibility, and the actual duty what she is doing? So, this discrepancy or this constraint can be analyzed by using this work sampling techniques. That is, the job that is being allocated to a particular human resource is not being done. So what is the reason for that? So how can we compensate this job responsibility that is being lacking from that particular individual? So these are things analyzed in the work sampling methods or the time motion series method. Finally, we have to decision making. Finally, come to a decision, that is the similar to the differential diagnosis or in medical practice. So the decision final we have may have a different number of decisions. So from that we have to come to a consensus and derive the most suitable decision for that particular health service by that health team. So that is being done by the decision making management technique. So this is in short about the different management techniques. So in summary, you must know what is the management technique definition by which we actively utilize all the material, manpower, money, and the time in deriving at the particular objective or time. And the different management techniques to be concerned with the behavioral sciences and the quantitative management techniques. So this is in short about the health management techniques that is being involved in our health service delivery system in India. So you can refer this from the Park's textbook of community medicine. Okay. So thank you one and all.